As we mark this World TB Day under the theme reaching the 3 million with TB who are missed by health systems, I would like to bring you to my friend Andrew, who shares his audacious experience with multi-drug resistant TB. 23-year-old Andrew Mikenga is a multi-drug resistant TB patient in Uganda who is now into his 7th month of treatment and has since converted.
Mikenga Andrew, I'm MDR TB treatment. I started the MDR treatment after the relapsed from the current treatment of TB.
His story, particularly on how he got TB, is a sad one. But the positive bit is that he is adhering well on treatment and improving every passing day. His late mother, Zaina, may her soul rest in peace, had TB, was put on treatment, skipped treatment, developed MDR, and for some reason stopped taking treatment completely until she passed away in September 2013.
My mother relapsed somehow on the drugs, so when she went for the testing, she was MDR TB also. She had to start the treatment. In that, when I went there for a visit, it is when I got it from her.
But before she died, according to a modest contact tracing done, she had passed on primary MDR to 4 more people, 3 of her own children and a neighbor. One of the children has ever since died, while 2 are now on MDR TB treatment, including Andrew and an 11-year-old beautiful minor.
3 people who got MDR from my mother. I'm the 4th person.
The neighbor, a 32-year-old casual worker at a school, has also been on MDR treatment for 6 months now, and although improving, he has lost his job, apparently because of being away for so long. Andrew is motivated to share his story because he is improving and would like to inspire other patients in the world.
Because there are some changes I'm getting. Because physically, I'm changing. I was weighing 52 kilos, but now at the moment I'm 63. That's too much. So in that process, I keep on continuing taking the tablets.
He is all praises for partners like the Global Fund to have made it possible to have MDR TB treatment available in Uganda.
Good job of bringing the drugs, coordinating with our government in the bringing of the drugs. Because if it wasn't the Global Fund, I could not.
The treatment has overcome with challenges. Uganda has adopted a mixed model of programmatic management of drug-resistant TB, where a bulk of patients is under ambulatory arm. Andrew is under ambulatory model and says he is challenged with food and transport money to go to the facility.
I don't have food, whereby the MDR treatment needs a lot of food. The body requires a lot of food. If you swallow the tablets and you don't eat, it brings more side effects. Like sight, you lose your sight. Then you don't hear properly. You become weak. Another challenge which I'm getting is about transport to take me to the health center.
He requests for any assistance from Good Samaritans. Andrew's predicament shows the cost of trying to manage TB without better community involvement and patient education. The diagnosis was got for his late mother. The initial drugs were available, but she could not adhere to treatment, developed MDR, and transmitted it to at least 4 more people, including him. We certainly must deal with the 3 million missed cases better than here. Poor countries like Uganda cannot sustainably afford to treat such resulting cases of MDR because they are very expensive. And as Andrew put it, he wished there had existed something that would protect him from contracting TB from his mother. That thing could have been an effective TB vaccine, which is yet to be discovered.
If you got the vaccine, you can prevent MDR TB from being transmitted to other people. If you are treated, you could move safely.
It's therefore important that as we actively research, diagnose, and treat TB, the world must also put aside money to fund research for effective TB vaccines that can protect people from contracting all forms of TB in all age groups and amongst all the world's populations.